While doctors are being overwhelmed by COVID-19 each day, they're also learning more about the virus. Now, to fight for more on that, we're turning to NBC medical correspondent Dr. John Torres. Dr. John, good to see you. So we're going to begin with this thing we're calling the Great Mask Debate. The president said yesterday that he could actually see a scenario where every American maybe should be wearing a mask, but that's really contrary to what the CDC said, because we've been saying for weeks on this show and many shows, like, not really necessary. So what's the right answer here?
And Hoda, you're right. This is the great mask debate, because it actually started this weekend with a doctor tweeting out that the CDC was going to change their guidelines and say people should be wearing them when they're out and about. I talked with the CDC yesterday. They said they have no plans to change their guidelines. Their guidelines are still what they've recommended, that people in the general public shouldn't be wearing them. A lot of experts are saying, yeah, it might help out a little bit. Why don't we wear them? Well, the truth is it actually might help out a little bit, but here's the caveats behind that. People have to wear them constantly. They have to wear them correctly, and they always forget, too, that their eyes are another way the virus can get in. So without eye shields, they're not getting all the protection they need to get. Might give them a false sense of security, so they might get inside that 6-foot bubble that we're putting around ourselves to keep away from the virus. If they do and somebody coughs or sneezes, they're still vulnerable to it. So that's one thing. On top of that, they're trying to protect the actual masks, the surgical masks, the N95 for frontline workers, because they definitely need them. Yeah. But as to whether it'll help out or not, is the CDC going to change its guidance and say so? You know, right now they're saying no. Could it potentially help? It could, but it's not going to give you full protection, and it's not going to give you any more protection than washing your hands and definitely keeping that 6-foot distance.
Yeah, and even if you did it at the CDC, I mean, the idea would be to do a bandana or something, not to use these surgical masks or the N95 masks that are so desperately needed by our frontline healthcare workers. Let me ask you another thing, Dr. Torres. There was a new study, a small one, but it suggested that transmission of COVID-19 can still occur even after someone's symptoms have subsided. Well, this is obviously quite disturbing, but I know it was a small study. What do you make of it?
So it was a very small study, Savannah. It was 16 patients, and they found out that half of them had symptoms and could actually give the virus to somebody else even days later, beyond that 3-day time period we talk about. But one thing, if you look at the study, these were patients with severe complications and severe symptoms who were in the hospital. And so it looks like with the mild and moderate cases, which the vast majority of people who have coronavirus have, it looks like that 3-day time period still holds. That's the time they need to make sure they're not spreading to anybody else once the symptoms go away, including fevers. But for people that are hospitalized, it might take a little bit longer. And this is where the doctors come into play. And somebody, when they're hospitalized and they finally get released from the hospital, the doctors need to sit down with them and say, here's how long you need to stay in isolation at home. Even though we're letting you out of the hospital, you might want to stick around your house a little bit longer to make sure it doesn't spread. But again, remember, a very small study, very limited number of people, and these were people with severe symptoms that looked like they could spread it for longer periods of time.
Dr. Torres, you've been talking to us over the weeks about viral load. I guess it's how much of the virus you are exposed to and how that can affect how sick you get. Tell us about that.
So exactly right, Hoda. Viral load is the amount of virus that first gets into your body when you start getting sick. If you get a little bit of virus, you're only going to get a little sick. If you get a big viral load, in other words, you're sitting next to somebody for long periods of time and that virus just keeps hitting you, you're going to get more sick. And those are the ones that tend to get the severe complications and the severe symptoms based on this. And that's why frontline workers are so exposed, and we keep talking about saving masks and equipment for them, because they're constantly near somebody. They're getting that huge viral load. It gets to the point where your body's immune system can't handle that overload of virus, and that's why we are so concerned about people getting a huge viral load up front, because if they just get that small one, they won't get as sick, and it's important to make sure that people obviously don't get that sick and recover from this as quickly as possible.
All right, Dr. Torres, thank you. As always, good to see you. We want to encourage folks to join us tonight. Hoda and I are hosting a special primetime show about the pandemic. This is the first in a series NBC News will be doing in the weeks ahead. We're going to examine the outbreak's toll, the country's potential new hotspots, and answer your questions. It's tonight, 10 Eastern and Pacific, here on NBC. You could also find it on MSNBC and our online streaming network, NBC News Now.